Hello, my name is Ralf Fuhrmann and this is my podcast, Room for Reflection. I've been a therapist for more than 30 years and for the last 20 years living in Argentine, attending and teaching osteopathy in my own school. My idea and great wish with this podcast is to create a space where doctors, artists, psychologists, musicians, therapists, and of course patients talk to me about health and everything related to this topic. I would like to invite us to broaden and enrich our way of seeing, thinking and feeling in order to recognize our personal responsibility in relation with our health. I believe to find our meaning in life is to find our path to health. And what is your opinion? This is my podcast, Room for Reflections, and I'm Ralf Fuhrmann. Hello everyone, I'm Ralf Fuhrmann. This is my podcast, Space for Reflection, and I'm really happy and have the honor. Today I'm with Timothy Marris. Timothy Marris, an osteopath living in England. And Tim, maybe you can tell us a little bit about your life. As far as I understand, you are teaching and attending your patients more than 45 years. So I think you have a lot of experience. But I'm very interested. Do you remember the first moment in your life, not the first moment in your life, of course, but the moment where you were sure, I will try, or I will study, or I love to help people? Or what was the main source, the idea? Was there a moment in your life where you felt, this is something for me, this is what I should do in my life?
Yeah. When I was about 10 and a half years old, my brother and I went with my parents to visit some friends of my parents. And my brother and I went to the local swimming pool along with their two daughters. Now, I and my brother were very keen members of our local swimming club at our local swimming pool where we lived. So all the way along the swimming pool, I knew exactly how deep it was. But this was not our local swimming pool. It was one that was built about 50 years before. So it was a very old swimming pool, and it was much, much shallower. And I dived into the swimming pool thinking it was going to be about 2 meters deep. And it wasn't. It was probably only about 1 meter 40. And I hit my head on the bottom of the swimming pool with quite a force. And I experienced what medically would be going unconscious. But the extraordinary thing was, I wasn't unconscious. I became fully conscious, but just not aware of my body. Wow. But my mind was totally conscious. And after a period of time under the water, still not aware of my body, this thought came in, I'm under the water. If I stay here, I'll drown. And there was no negative emotion about this because the experience was just truly blissful. But I realized that if I stayed there, I'll drown. And then there was a pause. If I drown, my parents will get upset. And then I became aware of my body and I swam to the surface and I got out. And being only 10 years old, I didn't think much about it, but I had a bit of a clear nosebleed. It was clear fluid with just a little bit of blood. and I didn't think anything about it. But somehow I knew I'd made a conscious choice to live. And from that moment, I knew I wanted to do something special with my life, to help people and do something in a special way to give back and help people in their life.
Wow.
It was only 10 years later, on my first cranial course, that I realized that the clear fluid would have been cerebrospinal fluid, which can happen when you fracture your skull. Then that confirmed, from a medical perspective, that I did really choose to live. I could have died. And that is what me led to do something that would really help people. And I heard about osteopathy, and that was it. I wanted to become an osteopath.
Wow. Wow, what a story. So I think it was an impact for you, and it is very interesting that you get the idea or the consciousness, the possibility to be conscious in this moment. Wow, great.
Well, to be honest, since that moment, I've never had any fear of death, because to me, I know it doesn't exist.
Wow. Excellent. This is a wonderful start. I thank you very much, Tim, because the idea of my podcast, Space of Reflection or Space for Reflections, is to help our listeners to get more ideas or maybe more tools to do something for themselves, to do something for their health. And I would like to know your opinion, but as far as my opinion is, with fear, and maybe you mentioned in this moment the fear of death, I think everybody should realize we once in our life, maybe you have another possibility, you so maybe you got twice in your life the possibility to face death. We have to face it, and we have to talk about our fear, or we have to accept our fear. What do you think? I would like to know your opinion. Why is the reason for you, after 45, 46 years, attending persons in your office, why we get ill? Why is the main reason, in your opinion, a person gets ill? What's the problem? The main reason?
Interesting question. Obviously, that could be answered on a number of different levels. Yes, you could say you've got ill because you've got an infection. But then, of course, the question is, well, why did I get the infection when somebody standing next to me did not get the infection? Fundamentally, I think illness is the body telling us we're not doing something right. That can be not doing something right on a mental level. Our life is just so full of stress that our physiology cannot function as it's designed to function. We've got all this, and all the different physiological systems start to fail and not do their job properly. And as a consequence, we get ill. We don't have a good immune system, so therefore we are going to be the few people who get the bad colds and the coughs and the flu, when the person standing next to us, exposed to the same bugs and infections, doesn't get it. They've got a strong system, we've got this stress system. The heart will start to have to work hard and pump, which will lead to it getting blood pressure problems, whereas a healthy heart doesn't have to pump at all, because the health comes from the cells of the body sucking the blood out of the heart. And so the heart muscle is just still gently beating, because the suction the cells for oxygenation and nutriment is demanding that from the blood vessels and sucking back to the aorta. But when the health of the body and the cells are not giving a good suction on the blood vessels, then the heart muscle is going to start doing the real hard work, which it's not really designed to do for many years. And then you start to get problems of blood pressure. Mm-hmm. So, why do we get ill? It's the body telling us something's not right, in my opinion.
Mm-hmm. Something is not right inside our body and as well outside, in the place where we live or in the place where we work.
Yeah, well, of course. Yeah, but again, you can have an environmental stress, pollution, but there are some people where that pollution affects them really badly, and other people, well, it's not very nice, but it's okay. The healthy person can tolerate all sorts of things that an unhealthy person cannot tolerate.
Okay, I think it's very interesting now you use two words, unhealthy, healthy.
Can I just say that if we don't listen to our body when we first get the illness, the body thinks, not listening, I'm going to shout louder. And they increase the symptoms until you have to take notice. So the body is trying to tell you things by pain or discomfort. If you don't listen or you just take painkillers, which get rid of the pain but don't resolve the problem, the body says, right, I better make a stronger pain, a stronger ache, a stronger illness until they really listen. That's my opinion.
Great. I think we have in this a lot in common, Tim. But I would like to hear, and maybe you can tell us in a few words. So if you are telling us the main problem maybe why the person gets ill is because he's not conscious about her well-being. He don't listen to himself. So what is your work? If a patient comes to your office, how can you help your patients that they can listen better to their body or to their lives?
Well, I think obviously it depends on the patient. Sadly but truly, some people are not yet ready to learn that information. They couldn't handle the fact. Some people couldn't handle the fact that they're the ones who are responsible for keeping themselves healthy. They're looking for the tablet, the medicine, the doctor to give them advice, for the osteopath to treat them and get me better. Whereas you, as a fellow osteopath, know that when a patient comes to see you, yes, we do the physical treatment to help that person, but it's a partnership. They've got to do the right things when they go home and not make things worse than what you've been doing to help them. But as I say, some people, they have not woken up to the fact that they are part of the partnership of getting themselves better.
Mm. Yeah. I understand it very, very clear. And this is one of my... Pardon?
I was about to say that I know a couple of people who are nutritionists, fully qualified nutritionists, and one of them just gave up being a nutritionist because the advice you'd give to her patients would be there and they'd probably pay a lot of attention for the first week. And then the second week, it gets more tricky. And by the end of the month, they're giving no attention to the advice they were given by the nutritionist. And she just found it so soul destroying that actually she wasn't making any difference, even though she was giving them good advice.
Again, I agree a lot with you, Tim. And one of my reasons to open up this podcast is to invite us all, to invite our listeners to listen to this podcast, to remind us said we have a choice and we have a great responsibility in relation to our health. Maybe still some people out there who, as you mentioned before, looks for someone else who arrange or helps me to get rid of my problems. You are traveling still a lot in Europe. You're still offering your treatments programs in Europe, Tim?
Yeah.
Yeah. Did you notice some different in the different countries? As far as I understand, you actually you traveled to Switzerland and you will travel next week. And some years ago, I remember you was Poland or Russia. Could it be possible?
Yeah.
Did you see any difference in the different countries of thinking or the behavior in relation to our with our responsibility with our health? What do you think? What do you see in your courses?
I think, obviously, as you say, I've taught in Russia and Poland, as well as Germany, Switzerland, France, and I'll be now started teaching in Spain. But although there's some variety of the financial comfort of different countries, for example, the financial status of Switzerland is very, very different to Poland, for example, or Russia.
Yeah.
But that may give them a more comfortable house and more comfortable physical things around them. But this does not necessarily change any more than any other country. So, throughout the world, I think there's probably a similar proportion of people who realize they are part of the journey to get themselves healthy. I'm only guessing, but I bet it'd be roughly the same proportion of the population all over the world.
Mm-hmm.
Because it takes a bit more being an inner awake person to realize I'm also involved in this.
Yeah.
Sure. When you are a little bit more mentally restricted, you just see, I need help, you're going to get me better, rather than I'll go to see you, you can give me some advice, and together we can get me better.
Great.
There's a difference.
Thank you for sharing this, and it's very interesting because I think you have a great possibility to see different countries in a short amount of time. But I would like to ask you, in your experience, more than 45 years, so if you remember maybe your point of view in the start, but of course, I think it's changed a lot, or not, I don't know. But I would like to know what you see in relation to your patients 20 years ago, 30 years ago, 30 years before. Do you see this? You mentioned there has to be a awakening, a special kind of more openness to get the idea or the sensation of our responsibility and the possibility we can do a lot for ourselves.
I do think there are more people now who are waking up to realize there's more to health than just taking a tablet or just taking a bottle of medicine. That with the right help, they can then work on themselves. I don't know if it's similar in places like Argentina, but, there's a lot more yoga classes in society now than there were ever before. Certainly when I first qualified you'd have to travel quite some distance to go to a yoga class, for example. And when I first became a vegetarian, I would have to travel 40 miles to go to a restaurant where I could have a vegetarian meal. Now, every restaurant has at least one vegetarian meal on its menu. Mm. So there is a tremendous growing of greater health awareness, but it's still slow process.
Slow process. And on the other side, Tim, I like to get more information about your experience. Did you get the impression the change of lifestyle in our last few decades was and is still responsibility for our illness? Did you have the idea that the life 30 years before was much more healthier, or it's only an idea? What do you think?
Well, I think we all know that the pace of life now is much faster than it was 20, 30, 40, 50 years ago. We've all got these things now, which, they say that there's more computing power in your phone than took people to the moon. That's a crazy realization, but it's true. And, there's a big thing now about how many hours per day that children are on their phone doing this, which is just focusing their mind and their attention on a very small screen. There's a lack of communication by talking and meeting people because of modern technology, particularly in children. And on one level, yes, now we have lead-free petrol cars, whereas 40 years ago there was a lot of lead pollution coming out of the exhaust of every car. So certain things have improved, but the demand on people's lives now, I think, is far greater.
Mm-hmm. And I'm not sure, Tim, I agree totally, but I'm not sure, as you started your opinion, I'm not sure that really many people are aware that the pace of life is much more faster than 20 years before. I think it's so gradually.
Question is,
people are so happy looking in their iPhone and with all the advices. They are disconnected and less sensitive.
Yeah,
maybe.
I think the pace of life, in my opinion, unquestionably has become dramatically more demanding. Mm. But not everybody realizes that.
And this leads me to another question. I think you as well are treating children in your office. Is it right? Yeah.
Yeah.
So did you notice something about the activity of the children? Did you see something in common? Problems with the concentration, problems with her body, with the skin, or something like this? You can tell us something about your experience with the children which visit you in your office?
Yeah. It's difficult to tell. I mean, I treat quite a lot of babies, and therefore it's difficult. You don't analyze the psyche of a baby. They just, they're a baby. I think school children are under more pressure than they used to be, perhaps. Obviously, there's a big concern now about, as I said earlier, about how many hours per day people are looking at a small electric screen. And this very much applies to children. So whether that continual bombardment of electrical frequent signals coming zzz, is perhaps not a good thing for the child. And we'll only know in 15, 20, 30 years' time if health issues have arisen because of that, in the same way that it took 30, 40, 50 years before they realized that a lot of illnesses are caused by smoking, but they didn't realize at the time.
Mm-hmm.
So it's difficult to say. I don't try and sort of analyze children now compared to children 20 odd years ago, so I can't answer specifically on your question.
But maybe we can give our listeners, the people who are watching our podcast in this moment, maybe you can tell them something about practically. So if a patient comes to you and you are noticing he's suffering a lot from the pace of life and he has to do his work, do you offer some kind of exercises, or what do you offer your patients in this moment? Actually,
it depends on the patient. If I'm honest, I very rarely give people physical exercises to do, because again, a bit like the nutritionist, they may do them for a week, maybe 10 days. If they came back in a month's time, well, I did them to begin with, but I haven't done them much recently. Sadly but truly, that was my experience when giving a lot of exercise programs to people. So I don't really do that much anymore. But I do say, if somebody's got chronic back problems, I just say, look, when your back's feeling a bit stronger, perhaps consider going to a yoga class, for example. Then it's not me giving them exercise. I'm just giving them advice to go to a class where they'll learn their own exercise.
mm-hmm.
So
coming back to
it's tricky because again, it's.
Pardon, Tim, you can listen to me because your picture's frozen. Hello, Tim. I hope you're still there. I can see your picture, but without voice, and it's frozen. Okay. Yeah.
Hi.
Pardon?
Yeah.
We had a problem with the internet, I think. Your picture was frozen, and okay. You can see me and listen to me?
So, yeah.
Okay, great.
So I'm not a strong prescriber of exercises, diet, or these sort of things, because again, we're one step up from seeing the doctor, but a lot of the patients are still not yet at the point of realizing that they're part of the partnership. People who see me a number of times, or they come back, they come from one condition and they come back in, say, 8 or 9 months' time with something else, or they come a third time, then they're starting to wake up to the idea that, oh, right, okay, well, look, how can I help myself? But, the majority of patients, that's not why they come. They expect me to get them better.
Okay, I understand. But coming back to our start, you told us you get the impression the problem is because the patient isn't able to listen to himself. So do you have something for us we can do maybe together? Some possibilities to connect our body, to connect our thoughts. I don't know. You talked once again about a meditation you offer sometimes. Could it be possible?
Yeah. Well, as osteopaths, it's very essential that we have got rid of our ego in order to truly hear what the patient is telling us without making assumptions, and also to palpate and feel the patient's tissues without also assuming they've got a problem in that part or another part of their body, so that we can get the true signals from the patient's mouth and from the patient's tissues to then make an evaluation and a diagnosis and how to treat. And this being without ego, that benefit also applies to the rest of our life and even to our health. Because if Mr. Ego says, I know what my problem is, I've got this problem, I've got to get a tablet from the doctor, the body's saying, yes, you do have that condition, but that's not really what I'm trying to tell you. I'm trying to tell you that you need to start doing a little bit more regular exercise, that you need to eating better, that you need to start thinking, well, your job's very stressful. What ways can you reduce your stress at work? And it's often the ego that ignores all that, thinking my life's fine, it's not my problem. It's up to you to get me, or the doctor, to get me better. So it boils down to what we said at the very beginning. Are you ready to listen to your true self? And if you are, there are techniques which will help to remove the ego and allow your inner self, your true inner self within your body, to talk to you and tell you what it's really trying to say when it's giving you that pain in the shoulder or that bad headache or that pain in the knee or whatever, because they're signals to say something's not right, you need to help make a change.
Great. I love this so much. I like it. I like it very much. What is for you the inner self? You mentioned the inner self.
The inner self, yeah. We are, most of the time, apart from when we're asleep, our attention is outward. I'm doing this, I've got to do this, I've got to prepare for this, I've got to then go over here and talk to this person, and I've got to prepare for this project at work, and we're always out. Most people, from the moment you wake up in the morning to the moment you close your eyes to go to bed. But there's another aspect to us. I believe the human person, the human soul, comprised of a mind, a body, and a spirit. Mind, body, spirit. And we tend to forget this inner spiritual aspect. Now, I'll make sure that there's a difference between spiritual and religious. Yeah. I'm not against religion, but they're not the same thing as the inner spirit of the person. Although many religions of the world do describe the effects of the spirit on the person, but whether it's Christianity or Islam or Mohammedanism or Judaism or whatever, Shintoism, whatever the religion of the world, the inner spirit or the spiritual aspect of the person is not the same as any religion. But by turning our attention inwards and finding our inner quietness, that's when your true self, which is expressed when you're in that moment of inner quietness and stillness, can really talk to you and dramatically, over the years, improve the quality of your life. Because deep down, that's what the body wants to achieve.
Yeah. I totally agree again with you, Tim. I love it, and I think you put it in good words. I hope a lot of our listeners could understand what you are pointing to. You mentioned in in our call last week said you can do maybe, but feel free if you are like so. You can offer us a meditation at this moment to get in contact with our inner self. Is it possible? Could be possible at this moment for you?
Yeah, I could do a little guided centering technique.
Oh, wonderful.
It's not. I myself learned a specific meditation technique when I was 18 years of age, and I was amazed that within 2 or 3 weeks of doing this technique, I started getting the same experiences inside myself that I experienced at 10 and a half when I hit my head on the swimming pool.
Wow.
In other words, experiences of this pure consciousness, which I didn't realize what it was then, but I knew I'd lost my body, but I was fully awake and I could have happily moved on, but I didn't because I didn't want my parents to get upset. But there are little techniques that you can do and breathing techniques to help you, which will calm the noise in your mind to experience gradually these quieter levels within yourself. And if you were to keep up these practices on a regular basis for many years, not just a few weeks, gradually you come to this experience of inner stillness. If you'd like me to just do a little guided experience, we could do that right now, if that's what you would like to do.
Yeah, I would like. I think it would be a great honor for us, for all of us, to hear you and to follow you.
Okay. So, first of all, you want to sit comfortably. So just get yourself on your chair, and if you've got a back to the chair, just decide, do you want to be leaning against the back of that chair, or would you actually be slightly more comfortable if you moved your back away from it? Quite often, depending on the chair, you're a little bit more comfortable in your spine if you don't lean against the back of the chair. So, having got yourself sitting comfortably, just close your eyes. Closing the eyes just helps to shield our awareness from the outside world and allows us to take our awareness back into ourselves. And what I'd like you to do is just become conscious of your feet. Have your feet so that they're against the floor. And just notice if one foot feels more comfortable than the other, or perhaps warmer, or are they similar? Then take your awareness up through the ankles to the lower leg. And again, is there more tension in one leg than the other? Is one knee more flexed than the other, or is it straighter? Bring your awareness up to your thighs, between your knee and your hip joints. Get a sense of the powerful muscles that exist there on the front of your thigh and the back of your thigh. Do they feel the same, or is one more comfortable than the other? Bring your awareness up to your hip joints and the pelvis. Does one hip joint feel freer or looser or more comfortable than the other? Or is one more pulled in or turned out than the other? Get a sense of your pelvis and your pelvic organs. You've got the bowel and the rectum at the back, and we've got our bladder, and in the woman, the uterus, all sitting within the pelvis. Are they sitting comfortably? Do they feel at ease within your pelvis, or does it feel a little bit tight or restricted to any of those organs? Obviously, in the male, we've got the external genitalia outside of the pelvic bowl. Are they comfortable? At the back of the pelvis is the very bottom of your spine, between the two pelvic bones either side of the pelvis. Does your spine feel comfortable sitting at the back of the pelvis? Or is there some tension there? Or maybe in the lumbar spine just above the pelvis? A common site of discomfort? Or is yours feeling quite comfortable? In front of your lumbar spine, you've got the lower part of your abdomen and digestive organs. Absorbing all the nutriment from what we put in the mouth to sustain the health of the body. Does that feel comfortable? In the upper part of the abdomen, we've got our stomach and the liver and the large colon going across next to them. The stomach feeling comfortable? If you take your awareness up into the chest area, we've got our lungs breathing, allowing oxygen in and out. Our ribs moving to allow that to happen. And of course, we've got our heart involved in the circulation and the blood giving oxygen and nutriment to all the cells of the body. The thoracic spine, the chest part of the spine, giving off all the ribs. And above that area, we've got the connection between the chest and the neck. How does that location feel? How does the base of your neck feel? Some people get tension there. And just below that area, we've got the shoulder blades, giving off our shoulder joints and our two arms. Do your arms feel comfortable? Or is there some tension in the muscles of one or both of the arms? If we go down from the forearms to the wrists and the hands, does one hand feel a bit more tight or achy than the other? Which can happen if you're very much dominant one-handed in all that you do. Now bring your awareness back up through to your neck and get a sense of the back of your neck where your spine is, but also the front of your neck, your throat, your voice box. How does that feel? going up to the top of the neck where it meets the head. Just gently move your head a little bit and just see if you can get a little bit more comfort in that location, as it's often a site of tension. Let your awareness go up into your head. You've got the bony skull giving protection to the brain inside, responsible for all our thinking, feeling, the five senses, calculations, planning, as well as various aspects of our emotions and how we relate to other people. And then at the front of the head, underneath the brain, you've got our face, our eyes, our nose, our mouth. Are they feeling comfortable? Or is there some tension in your face? If we're all honest with ourselves, you'll probably find there is some tension in your face, because we have a duty to face up to other people, and it's not always easy. Now, when you're ready, just whisper quietly to yourself, where do I feel most comfortable? Ask yourself that question. Where do I feel most comfortable in my body? Could be anywhere. And just let your awareness go to that place where you feel most comfortable. If you're not sure where it is, just go by feeling rather than a specific thought. Just get a feeling of where you feel comfortable, or perhaps the most comfortable. And as you do so, just let your mind go there, and you'll find that it has a relaxing effect on the mind also, as well as the body. Just get a sense of that inner peace, inner quiet, as you let yourself go to that place where you're most comfortable in your body. Just enjoy that feeling. Because when you let your mind go to that place where you're most comfortable, it helps to free the mind, allows the mind to expand, to find your true inner quietness, your true inner self. And then very, very slowly and gently open your eyes.
Thank you very, very much, Tim. Yeah. I like this. I like this a lot. And actually, I think, I hope a lot of other people will listen today to us, maybe as well could have the possibility to discover it is not difficult. But I've take time.
Yeah.
I have to take time.
Yeah, this is what we've just done, is what we call body feeling. And then, which is a common thing in yoga practice, but then I developed this approach of letting the awareness go to where you feel most comfortable, and suddenly the mind goes, ah, and feels free.
Yeah.
And then you can start to feel your own inner stillness.
Yeah, great.
But do it on a regular basis. It's not going to get long-lasting benefit from just doing it the once.
Yeah, hopefully a lot of people who listen to us felt with this a possibility, a start. It's a great idea. Tim, as I see the time is going by, and I think for today, maybe for our first podcast, should be enough. But if you like to add something else, or some few words, or some idea, at least at the end, for our listeners, to how can I improve my health? What can I do for me? So it was very, very wonderful meditation, an invitation to look inside and to listen to yourself. Something else you like to add, Tim?
There's a very simple, again, it's like a yoga breathing exercise. You use your middle finger on the bridge of your nose. You have your forefinger, first finger on the bridge of your nose, your middle finger on one side of the nose, and your thumb on the other. So you like this. 1, 2, 3.
Yeah.
And then you close one nostril and you breathe in, close, and you breathe out on the other side. And breathe in the same side, close, and out the other side, in the same side. So you're doing this: breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, like this.
Yeah.
And you do about 5 minutes, and it helps to get both sides of the nose breathing, because you actually, at any one time, just breathe through one side. You don't realize it, but if you put a mirror under your nose, you find that one side you're breathing and the other side you're not. And by doing this, it helps to open up both sides of the brain. And it's also just here is where some of the fluid around the brain drains back into the rest of the body. And I think when you do these breathing exercises, it helps to stimulate that cerebrospinal fluid, the fluid around the brain.
Wonderful. Great.
And just by doing that for about 5 minutes is a very calming thing to do. So when you're feeling a bit stressed and a bit anxious and my day's gone on top of me, just gently do this breathing exercise, about 5 or 10 minutes if you've got the time, and it'll go, and calm you down.
Great. Thank you very lot. Thank you very, very much, Tim. At least some people who are listening to us, how can you find you? Where you are living in England, and how can I get in contact with you? Maybe you have some email, or how can it's possible for us to get in contact with Tim Marris?
Okay, yep. So my email address, it's tim.marris, that's MARRIS, that's who I am, tim.marris, at Osteopath, what I do, who I am professionally, Osteopath, then continuing all one word, Osteopath Ashford, that's ASHFORD, so Osteopath Ashford, all one word, .com.
Great.
So,
and of course
tim.marris.com.
And of course, we'll put it in words, so the person who will listen to you and to us in this moment, he can find you very easy, I'm sure. Yeah. Tim, it was a great pleasure for me to listen to you again, and I hope I could invite you in the past a few times to Argentine, and hope it will be a next time, maybe next year. It would be a great idea. I think you mentioned you will do a teaching next year in Brazil. Is this all right?
End of August, that's right, yeah.
Next year in August in Brazil. Maybe it could be possible that we can see us there next year, hopefully. But we'll stay in contact, I'm sure. So thank you for your time.
Yeah. Okay.
Thank you very much for your time, Tim. And I enjoy yourself. Please stay. Please, my best wishes for your family. And thank you again. This was my podcast. My name is Ralf Fuhrmann. Space for Reflection. Today with Timothy Marris. Thank you a lot. Bye-bye.
Thank you. Goodbye, everybody.
Thank you for listening to this podcast. If you enjoyed this space and would like to share your reflections with me and others, you can stay in contact by subscribing to my YouTube channel. Thank you for your like and feel free to share it with your friends. This was Room for Reflection with Ralf Fuhrmann.